I still can't get over it. I came up here for my first visit and didn't really get to see him until, what, 2 or 3 days later?
I'm sure most doctors haven't had a patient actually go into cardiac arrest in their lobby on the first visit and then survive. Mr. Dunn's daughter actually scheduled him an appointment with me. He moved down here from Connecticut. He had already had a history of heart disease. He had a bypass surgery. So as soon as he walked into our office in the lobby, he collapsed. And that's why he doesn't remember anything. He says he just remembers coming to see me, and then he actually saw me 2 or 3 days later because he actually went into cardiac arrest in the office. So he walked through the threshold of our lobby and collapsed. And sure enough, we check a pulse and he doesn't have a pulse. And so we start doing CPR, we get our crash cart, we hook him up and see that he's in full-blown cardiac arrest, he's in ventricular fibrillation. So we shock him. I think we shocked you about 2 or 3 times, at least 3 times. We were able to restore rhythm. Of course, we had already called 911 by that time. We were able to get him to the hospital, took him to the cardiac catheterization lab.
And I came through and he was sitting there looking at me.
Heart attack sometimes leaves scar tissue. That scar tissue is then more prone to developing abnormal heart rhythms, especially if the heart is weak. And so if you have a combination of someone who's had heart attacks, developed scar tissue in the heart muscle is weak, that increases that person's risk of having dangerous heart rhythms like the rhythm that Michael had, the ventricular fibrillation. And so when patients have those dangerous heart rhythms, that is what leads to cardiac arrest. Cardiac arrest happens in about 350,000 people in the United States a year. The survival rate for cardiac arrest in the United States is about 10%, and some literature says actually less.
I'm glad he helped me to survive and whoever else was involved.
I enjoy seeing him. We have great visits together. We talk about how blessed and fortunate he is. Here at Northside Hospital Heart Institute, we actually try to differentiate ourselves on several levels. The main thing is the patient experience. We want patients to feel like when they come to Northside that they're going to get comprehensive, total care, state-of-the-art care. We emphasize treating patients like human beings. We try to not treat patients like they're just a number. We want to actually take the time and actually explain to patients what's going on. And at the same time, we want to offer them cutting-edge treatment. So all of our doctors really emphasize practicing evidence-based medicine, keeping ourselves up to date on the latest technologies.
I think we're very good together. I like him, and he's helped me a hell of a lot. And the idea that I guess you could call me one of his survivors. How many miles you think are on my heart?
He's one of my favorite patients. I mean, he's got a great sense of humor, and I really enjoy taking care of him.
Thank you very much for you and your helper's labor.